working based off of diagnosis or patient presentation, effleurage, there's usually going to be some type of swelling present. So like the one I'm choosing is effleurage because he has swelling. So we'll say Ray had a knee replacement or something. So actually towels, can somebody grab a couple towels? We should do this correctly as far as draping and patient positioning.
Pretend it's a call.
Yes. So let's say Ray had a total knee. So with a total knee replacement, he's going to have a pretty nice incision running down his leg. So as far as sequencing goes, if he has an incision that looks like it's kind of building up some scar tissue, so his incision is going to be running like this, right? So of the two, cross friction or effleurage, which one do you think you would do first?
Cross friction.
Why?
To break up the scar tissue. The lotion.
Yeah, because it doesn't need lotion, right? If I do all my effleurage work on him first and then go to do cross friction, I have all the oil on it, so then I'm losing some of that friction. Okay. Another little aside, if you have any type of post-op knee or knee pain patient, yes, he has swelling, so that's why we've elevated him. Another thing that you're gonna need to do is you're gonna need to probably put something else under his leg. So Tommy, can I have that pillow? So we'll learn more about this next semester, but do you think I wanna put the pillow, he had a knee replacement, do you think I put the pillow that way? Or do you think I put the pillow that way? Why? Yes, but what's unique about this position as opposed to with the pillow the other way? What's it doing? Yeah, it's keeping him more in an extended position, but I'm supporting him so it's comfortable. Versus without this, a normal knee replacement, when they lay down, their leg doesn't go completely straight, so his knee kind of bended just like that. That might be where he comes in and it's relaxed, and so now he just has like nothing supporting him, and that's going to be a sustained stretch. For that long, it's going to get really uncomfortable. Okay, and yeah, if we put it this way, then it's going to keep him in a flexed position, but with total knees, usually the first thing you're working on is extension, so we don't want to keep him in that flexed position that we're trying to avoid. Okay, so with effleurage, again, when you guys do this, you don't need a ton. Like this is going to be way more than I need to do his knee. So again, if we're assuming total knee patient, he's going to have swelling throughout the whole lower extremity. Okay, with effleurage techniques, you want to work distal to proximal. Okay, so we want to be moving all the fluid up, right? We don't want to be pushing the fluid down. Okay, so all my strokes are going to be going distal to proximal. Okay, so you can either take some, I usually kind of just like to take some, put some on my hands and then get it all over the area that we're working on. So here, and you don't want to forget about the back of the knee too, because the back of the knee is going to have some swelling. Okay, so another important thing to remember is that you want to try to have contact on the patient at all times. So you're not doing like effleurage, taking my hands off and then coming back up. You want to try to maintain contact at all times. So I have like left hand and then right hand, left hand and then right hand. Okay. Again, with the effleurage, we're just sticking with the skin. I'm not trying to dig into his muscles. Okay. Try to avoid, you're not using your thumbs, right? You're not doing this. Broad hands, right? The more contact you have on the patient, the more comfortable he's going to feel, as opposed to like this. That's weird. Okay. So
creepy hands.
Broad hands, palm of your hands. Okay. And then you work your way up. Now, when it gets to, so I am going to want to address the back of the knee because it's the whole lower extremity that is swollen. Depending on the patient, depending on the diagnoses, you could have them flip over. You can get into the habit, high-low tables are much easier, but you can also do something like this and then come in and work this way. So you can work the back of the leg this way is an option, but again, you're trying to avoid using your thumbs, okay? If you can use like along the pinky side, okay, that's gonna be better. Using this and your palms, not your thumbs. And again, this one's very gentle. It shouldn't be uncomfortable. So what you're asking the patient, how does that feel? It shouldn't be painful. Are you in a comfortable position? How does that pressure feel? Those are the kinds of things that you're asking the patient. Okay? So body parts for this: lower extremity, upper extremity, ankle. Those are kind of the 2-3 main areas that you're doing this for. Okay? When we do petrissage, we'll talk about how you're going to do a little effleurage first and then go into the petrissage. But for now, we're just doing effleurage for swelling. Okay, so effleurage for edema.
So it'll be the same difference if you do, like you said, upper extremity, like for the arm. You start from like the wrist and go up.
Yeah, and I might do like prop him, right? So if he has some type of swelling, can you scoot that way just a little bit? If he has some type of swelling in his upper extremity, you're trying to build this up so gravity's helping you with that. Okay.
So would you have his arm elevated then?
Yeah, I'd probably have one more. If he had swelling in his elbow, wrist, hand, whatever, I might use one more pillow to prop it up.
And do you see the swelling like going away?
Yeah, you might. Yeah, you definitely might. So you could even take, again, next semester we'll learn pre and post measurements. Like you could do a girth measurement and do pre-treatment, post-treatment if you wanted to. But yeah. Comforting him. End of life.
End of life.
Another thing too that Miss Petrix reminded me that I wanted to talk about is now is a great time to talk about fingernails. Okay? So ladies and males, you want to keep your fingernails very trimmed and short. You don't want to be having long fingernails in this line of work.
So you can't get
Okay?
nails done?
No.
No manicure.
No mani-pedis. Keep them trimmed, keep them clean. Some of the stuff you're doing, if the nails are long, it can poke into the patient and it's not going to be very comfortable.
If you wear rings, you gotta take it off.
You could, yeah. I just would get in the habit of, if you're going to be taking them off, I would either just not wear them to work because you don't want to be losing them.
Okay, or?
Yeah.
Nail polish goes on too.
Yeah. It's nice to have a watch at work because you can always keep track of time if you're doing timing stuff with your patients, but if you're going to be taking it on and off, you just don't want to lose it. Okay? All right, let's try this one. Thank you, Ray.
So this is mainly for edema, they stay right there.
Again, you just need a little bit.
Dr. Laura, do you have any tips for effleurage?
I do. Effleurage is a larger area, and you are also feeling. That's an opportunity to assess, are there nodules, knots, inconsistencies, so that when it comes time to pick a smaller area to do more pressure, you know where to go. So we start with this so the patient is getting used to our touch, and we are assessing what the area, what's underneath the surface of the skin, where do I want to focus the other techniques I'm going to do.
Okay. Thank you.
My pleasure.